Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we are talking about peroneal tendonitis and kind of what tendonitis really is. So definitely tune in. But if you're having kind of that strain on the lateral side, so the outside around that ankle bone or up and down around that foot, this is what you'll want to tune into. Of course, this is just one type of injury that we talk about. We have so much more on here that you can learn about. Anything from back pain to neck pain to all the different pains that you've had, plus some certain exercises to help certain areas of your body. So don't forget to subscribe to this channel so you don't miss out on learning about those things, learning how you can really help your body. And if you have more recommendations, we're always open to hearing from you. So drop a comment below on what you want to see. When you press down on the ball of the foot, mainly, this is when you start to really activate and feel the outside. So if you've ever done like a heel raise, or the first time I really felt this was in Pilates, I will say, where a lot of times when you're working on the reformer and you're really focusing on pressing through the toes on the reformer and pushing the ball.
It's hard to drink coffee when you're wearing these microphones.
Trying not to get distracted by your weird face right now. But when you're pushing through the ball of the big toe underneath the ball of foot, and you're really pushing in, like your ankles coming toward each other as you do that heel raise or pushing up onto your toes, you start to feel the outside of your calves. You might think that's the outside of the calves, which to a degree, yes.
It is. I mean, it's technically a calf muscle.
Yeah, but you really start to fire up and feel the peroneal muscles. And I think that's one of the most powerful ways, especially the longest, obviously, is where you really feel that. What we really want to understand is what is the mechanism of this injury? And we want to start to change the conversation from this acute inflammation that's happening and I need to ice and rest and compress this area, right? To more of this active treatment of what I should be doing to help repair the fibers that are kind of disorganized. And so we're going to talk about that, but mainly the people who probably get into a lot of these types of injuries, we're going to look at athletic runners. So people who are really, maybe it's not your job to go out and do marathons, but it's someone who's running on a regular basis, maybe young dancers. We're looking at ice skaters and any kind of sport that has a lot of change in direction, because obviously there's a lot of control of the foot ankle complex that goes into that.
Yes, people who are athletes probably experience this at a little bit higher rate, but even if you're somebody who's just starting walking again consistently and trying to introduce walking on a consistent basis, and maybe you're gung-ho and you start and you're like, I'm going to do a half-hour walk a day. Well, if you weren't doing a lot of walking previously and then you start to go half an hour a day, we're really going to be loading those tendons a lot, and they might start developing this dysregulation. And that's what we want to talk about more when we talk about the tendons. It's not inflammation, it's dysregulation.
And I really think of anyone who's on their feet all the time for work. So thinking of nursing, thinking of teachers, you know, anyone who is on your feet, labor intensive type of work, you're constantly changing directions. And we're always trying to say, oh, what's the best type of shoe? What should I put on my foot that's going to help? And I think when we get to the treatment aspect, especially if you know that you spend a lot of time on your feet and you're not working actively on your foot, you're going to want to hear these exercises, because as much as we talk about shoes and footwear, there's only so much that they can do unless outside of the footwear, outside of work, outside of what you're doing on your feet, you're actually working on improving your foot function. When we talk about what you can do, it does have to become kind of a full body understanding and building this awareness of your foot prior to injury, prior to having any of these diagnoses, is always going to be the best thing that you can do. Because if we're talking about a repetitive motion in one range of motion happening over and over again, and we need something different, well, then if we just continue to learn something different within our body, then we help to avoid or understand how our body can perceive these new ranges when we start to go into that.
When you're standing at a computer charting, like I worked 13-hour shifts in hospitals too at one point, and it's like, where can you find that 30 seconds or minute in the day? And I loved being at the standing computers in the hallway right outside someone's room, typing in a quick note, pumping my ankles, doing a few things, with my upper body, and then getting over to the next patient's room. Like, there's ways you can throw these things in where it can feel more manageable than like, oh, I need to get a half an hour of mobility in, but I work a 13-hour shift.
Because we're going to talk about some of these exercises that you can do, but how do you know what you need to do specifically for your foot? Right? And that's why we do have a barefoot mini course.
The best.
And this takes you through daily assessments, only 2 weeks. It's 2 weeks because you have daily assessment and exercises and educational resources, plus a workbook. There's a lot of information to continue to learn, and you're going to have access to this. We just changed it over. You have lifetime access.
Lifetime access.
So it's your resource to continue to come back to and feel like you can move through on your own time, but really gain this awareness.
It's truly like your self-masterclass in your own foot and ankle. And people will ask us on different social platforms all the time, like, oh, I'm experiencing this with my foot. Like, what could be wrong? And there always could be like 6 or 7 things contributing to whatever you're feeling, whatever pain, whatever restriction or aching you're feeling. This Barefoot Mini Course will help point that out to you. Through the assessments. There's over 12 assessments that help you self-assess certain things, all the way from your toe mobility to your squat or how you're walking. And then it gives you exercises to help work on any restrictions you might have. So that is the answer. Go check it out. I think code OPTIMAL gets all of our podcast listeners an extra discount on that course. So we'll have that linked up down below. But exercise. Where does someone start? I
mean, in general, so if we're saying, it's so closely connected, we kind of said to the back of that calf, right? To the gastroc and the soleus, those main muscles. So having that mobility within the back of that ankle and calf is so incredibly important. So that's one of the main places that I would start to address first. A lot of people have a lot of restrictions there because we don't spend a lot of time. Maybe you do a little, hang your heel off a curb every once in a while, especially if you are walking or running more. But are we putting intentional work into stretching both the gastrocnemius with a straight knee and dropping that heel, and with a bent knee and stretching the soleus? So are we getting that full ankle capacity to move into a better range of motion? So we need that mobility through the back.
So not even loaded. So if you're like sitting and just pointing your toe and going into inversion, so kind of pointing your foot down and in, and then trying to pump your foot back and forth. So you're kind of pulling it back towards your legs with that toe still kind of pointed in and then pointing it down. That's going to really help to lengthen those peroneal muscles. There's even a peroneal nerve glide that you can do laying on your back, where it's kind of like the sciatic nerve glide, but you're going to be, again, pointing that foot down and in, and then pumping the ankle back and forth towards your body. So
it's in the foot and ankle plan.
In the foot and ankle plan. And that's one place we tend to tell people to start, is like find full active passive mobility to this. That's going to help hopefully bring down any irritation or pain that you may have in the area, and then prepare you for the next step, which is strengthening.
Right. And we have to understand that a stretch is a load on the tendon. So whenever you're doing stretching and flexibility, make sure you're not pushing it. Okay. We want to feel something, but we don't want to push. And the harder you go doesn't mean the better the result is going to be, especially when you are in a state of pain and injury. We want to gradually build up even our flexibility and mobility. So we have to know that that is a load on the tendon. And if we're talking about rebuilding that tendon health, make sure that you're not aggressively going into it. Because I've gotten people like, oh, I did that and I hurt myself. Well, I'm like, well, how were you trying to look like me? Like, I'm not injured right now. So make sure you're listening to your own body.
And then we want to strengthen. And knowing that the peroneal muscles do eversion, even just doing some active eversion exercises can really be a great place to start. Also strengthening around the foot in ways that are going to further help support that muscle by strengthening our foot intrinsics. And there's multiple different ways that we can strengthen our foot intrinsics.
I mean, and one of the best ways is can you spread your toes?
Yeah. Active toe spreads, which even when I started doing them consistently, 3-4 years ago now, my toes didn't move move much.
Yeah.
They still don't move a lot, but they're getting there.
Yeah. So working on those foot intrinsics, we'll show different examples of that. And like I talked about in the very beginning, is just getting control of that heel raise. A lot of people, when they're doing heel raises, you're just going up as high as you can, locking out your ankle. But what ends up happening is that ankle is kind of going out to the outside. And so we're not getting good control over those peroneals then. So you actually want to do a heel raise, kind of squeezing the ankles toward each other. So you could do this like squeezing a ball between your ankles, and it's going to keep those ankles in alignment, plus squeezing into the inside and making sure you're staying over the ball of the big toe, which you will then start to feel the lateral calf area, the peroneals start to light up and fire, which is a great way to gain that strength and control, especially when you do it very slowly and controlled.
We want to start training back into proprioception. One of my favorite is doing different balance exercises or single leg exercises, because that's going to challenge the body to understand, again, what it needs to do to keep balanced. It's going to cause a lot of co-contraction around that ankle and that foot so that the peroneals start to learn how to work in concert with the other muscles around the ankle.
Yeah, it's just starting to talk to your brain so you get a lot of better awareness of what's happening down there. Even if you just started with like isometric, so just like holding a band and then holding the foot out to the side, that's already starting to rebuild that connection to the brain and tell you where those muscles are in space, where that foot is. So even just starting there and then going into some balance exercises, maybe you're on 2 feet and you're throwing a ball with someone, and then you go to a single foot and you're kind of, again, throwing a ball back and forth. So different ways that you can start to develop that balance, that awareness, that proprioception, and then, continuing to progress into more lateral type movements.
Yeah, and at this level, it's more about what your goal is. Like, are you someone who's looking to get back to a sport or activity that requires a lot of jumping, a lot of launching, like even running, a lot of that ballistic motion? Then we're going to go into more intensive plyometric exercises, because when we start getting that more intense load and that quick stretch and the control in the eccentric or the landing motions, that's when we start to re-educate that tendon a lot more. So progressing into a little bit, like Jen said, more of the multi-directional or jumping type plyometric exercises would be a great place to progress into.
Mixing up your current workout. So even if you're like, nope, jumping isn't what I'm going back into, but I do work a long job. Well, when you're doing your exercises, are you just doing squats, lunges, and moving in a front and back kind of plane? We want to make sure we get a side to side, because again, we're talking about the peroneals, which are on the side and the outside of the ankle, right? So we need to be doing movements that move you side to side and getting that foot and ankle strong in that pattern. So even thinking of lateral lunges, rotational lunges, things that put your foot and your ankle in a different plane of motion. This is going to be so important when you're starting to retrain that tendon.
Like
as
a
well.
6-way foot tap that we do for almost any foot and ankle related issue, because it gets your foot, gets your ankle, gets you working everywhere up through the calf and the hip, in all directions. So standing on one leg, tapping the foot in front, behind, to the side, reaching back and around, tapping on the other side, and then you kind of twist and tap in front and twist and tap in back. That's a whole bevy of things that you can do to start re-educating, to start reorganizing those tendon fibers and getting back into more pain-free movement when it comes to foot and ankle. And we have so many other episodes, talking about tendonitis in different areas of the body. If you had any interest, check out that Barefoot mini course. So much information in there that's going to be able to help you out educating yourself on where your specific restrictions are. Thanks for popping in for another PT Pearl all about that peroneal tendonitis. What did you learn? Do you have any questions on how to do certain exercises? Do you have any questions on other topics that you might want to hear? Thank you so much for being with us. If you have interest in learning more, we have a Barefoot mini course that is an absolute masterclass in the foot and ankle that can help you understand where your restrictions are and how to start working on them. That'll be down in the description. And of course, we'll see you next time.